Medical identity theft is something that I think most consumers and even many in the healthcare profession really don't understand yet. It's a problem that's growing. We know it's growing, and yet it's somewhat hidden. And the reason it's hidden is that many of us really do not get to interact directly with the financial accounting of our health insurance. Many of us are on HMOs, we go get treatment, we pay our $10 and we leave. And we often don't think carefully about, well, what would happen if that information fell into the wrong hands, and if it were used, would I ever even know it? We'll give you some examples. Just in the last couple of years, there have been a number of very large cases exposed where either prescription drugs were being charged fraudulently or even medical treatment itself. Probably one of the most bizarre is a case that recently occurred in California where an illegal alien was able to gain access to rather extensive medical care that eventually led to full heart bypass surgery, all based on fraudulent identity. It was only after the operation was complete and the hundreds of thousands of statements were flying around that the individual who it was perpetrated against realized that their identity had been stolen. Medical identity theft occurs very much like financial identity theft in that the perpetrators steal important confidential information, typically insurance numbers, social security numbers, information related to your identity that they can then use to gain access to treatment or to pharmaceutical supplies. And it can be as simple as fraudulent billing against Medicare or Medicaid. Many times those who experience identity theft in this way often don't know it for months or years later, much slower than you would find in the financial cases. Well, one of the things that's a little frightening is that we don't know the full scope of the problem yet. When we look at the data, we see that there is substantial medical theft occurring, but no one is really tracking the overall size of the problem. And unlike credit card issuers who have a big stake in tracking this, the stakeholders are much more diffuse. And really getting good information on what's happening is tough.